her concern was primarily around, well, if I'm not having a period, how do I know where I stand hormonally? So we actually do have a study in 2012 that looked at participants over the course of 12 months. Now, although this isn't something that I did prior to getting my IUD, ultimately will make fat loss more challenging. What's up, guys, and welcome back to the channel. Today we are talking about hormonal and non-hormonal IUDs. Before we begin, do me a favor, hit that subscribe button if you want to see content just like this moving forward. For me, this was a very easy decision. I didn't want to form a birth control that was going to have any kind of impact on my hormones. In this video, we are going to go through the benefits, the risk, and common concerns individuals have over this very popular form of birth control. Be sure to stick around to the end to get the full picture on whether or not you should be using a hormonal or non-hormonal form of IUD. Mechanistically, how do IUDs work? So IUDs are a form of birth control that work a little differently than a pill. They are a barrier method of birth control as opposed to a combination pill where this is going to directly suppress gonadotropins in order to prevent the likelihood of getting pregnant. The hormonal IUD is a barrier method that has minimal impact on serum hormones and the HPO axis. Whereas the copper IUD works by using copper ions to create an inhospitable environment, preventing fertilization. Some systemic effects have been documented with using the hormonal IUD, including depression, brain fog, nausea, anxiety, irritability, and that's not to mention decreased libido, ovarian cyst, hair loss, and acne. Really, the biggest advantage of the copper IUD is that it isn't hormonal. We know that hormonal birth control can have a negative impact on athletic performance, specifically muscle growth, endurance, and recovery. But to be fair, let's look at the side effects associated with the copper IUD. One of the most common side effects is increased menstrual bleeding. Some women do report experiencing heavier and longer periods. For one, I would recommend using an NSAID in order to manage those symptoms, specifically when you're on your period. My periods before were pretty regular and they lasted anywhere from 4 to 5 days. Since having the IUD, I can confirm the pain, the cramping, the heavier days. Yes, I do have a really heavy day and it can be a pain sometimes. Although these symptoms do vary person to person, it's important to note that for some people, this is going to be a deal breaker. When I weigh out the cost benefit for having the IUD and having something that's able to prevent pregnancy without directly impacting my hormones negatively, in the grand scheme of things, it's really not a bad trade-off. There are some women who do have a sensitivity to copper. Symptoms would include rash, redness, swelling. If you have any doubts whether or not you are sensitive to copper, for sure, a good way to go about it is to get the allergy test. I do wear a lot of cheap metal, and I can say that blends typically do have some copper already in them. If you are not having a severe allergic reaction to any of your cheap, less expensive metals, it's very unlikely that you have a copper allergy. Now, although this isn't something that I did prior to getting my IUD, I think it's a really good idea to make sure you don't have a pre-existing copper allergy. Locally, there will be some absorption of that copper. If you're not getting enough zinc from your diet already, it could be a good idea if you're going to get a copper IUD to make sure that your zinc intake is adequate. One of the things I really like about the app Chronometer is it'll actually track your vitamin and mineral intake through your whole foods. For me, this has been really helpful in identifying any gaps in my diet. I do supplement with 10 milligrams of zinc just to be on the safe side. One of the most common questions I get is whether or not the IUD is going to have the same kind of negative impact on fat loss the way the pill would. So we actually do have a study in 2012 that looked at participants over the course of 12 months. What they found is that the group that was on the hormonal IUD, they actually gained 6 pounds of body fat and ended up losing some muscle during that time. However, what's really interesting is the group that had the copper IUD, their body composition actually changed over the course of 12 months. Although their weight went up by 3 pounds, they actually saw an increase in lean body mass. Although we do know that resistance training will directly cause an increase in bone density, this is something that we see declines with age. Now, this is really important if you have any kind of pre-existing condition that's going to put you at risk. Hormonal forms of birth control will cause a decrease in bone density, especially for younger athletes. The copper IUD does offer a pretty significant benefit compared to the hormonal one, as it does not impact bone density. Now, a risk that's associated with both the hormonal IUD and copper IUD is risk of expulsion. Expulsion refers to the IUD coming either partially or completely out of the uterus, which obviously, if the idea is to use the IUD to prevent pregnancy, if it's no longer in the uterus, it cannot do that. For one, have an experienced healthcare provider do the insertion. Although it might seem very obvious, it is worth looking into different providers and getting an idea of their experience. Now guys, I am biased. I've had a copper IUD for almost 5 years now, and I can't say enough about it. My experience has been very, very positive. It meets my needs in terms of birth control method. I didn't want to form a birth control that was going to have any kind of impact on my hormones. So I did get a really good question from Patreon. So she has the hormonal IUD, and she's had it for about 4 years. However, she is not having a period. And her concern was primarily around, well, if I'm not having a period, how do I know where I stand hormonally? More specifically, am I hiding valuable information from myself by not getting that period? Now, the Mirena does have a very small amount of progesterone that's released locally. And could this have a negative impact on my ability to lose body fat during a contest prep? This is why it's really important to consider whether or not there is a reason for having the hormonal IUD as opposed to the copper IUD. I think it's really important to have good rationale behind picking either the hormonal IUD or the copper IUD. Will this negatively impact you during a contest prep? Absolutely. If you're not having a cycle every month, you're not ovulating. So simply put, yes, it will affect you systemically. And any kind of secretion of exogenous hormone will cause the suppression of your endogenous production, which ultimately will make fat loss more challenging. Will it completely cease your ability to lose body fat? No. But we know that estradiol and progesterone both have very positive impacts on your ability to lose body fat and build muscle. Remember, this is a big decision and it's crucial that you discuss it with your healthcare provider. Personally, in this case, I would have the Mirena removed and I would replace it with the copper IUD. I hope you liked the video, guys. If you enjoyed this, please let me know in the comments below. It does help the algorithm. If you are looking for exclusive content where I talk about the ins and outs of female PED use, be sure to sign up at my Patreon. The link is in the description below. As always, thank you for watching and I will see you in the next one.